Sometimes on my night shift, I would be doing some practice questions online. NGN NCLEX. What sort of questions there? By doing these days and nights, it was a week left before the exam, which is the shortest bone in your body or longest muscle or organ in your body. Don't even expect they will ask you such silly questions. You actually studied for the exam for only 1 week. Believe me, man, just a week. They won't even ask you which is the rhythm with a diagram. No, if there is a question about rhythms, they will ask you, okay, if potassium is the most favorite thing they ask you in the questions, cardiac system, rhythms, shock, CPR, lungs, life-saving and pharmacological drugs. CAT will use it to find a confidence interval of 95%. You to stop asking you more questions. And guys, practice. That's the best advice I can give you. Just remember, if I can do it, you would definitely do it. Assalamu alaikum everyone, hope you're all fine. Welcome back to this channel again. So many of my colleagues were asking about my preparation for NCLEX. How did I prepare? How long did I prepare? What sources did I use? How much did I pay for it? And how come I passed this in first attempt? So today we'll talk about all these questions and about NGN NCLEX. What sort of questions there, time limit, pass-fail criteria and all that. So all brilliant nurses, I started my NCLEX process through CGFNS on October 2022. And by the end of 2023, which precisely I received my license on 20th of December 2023. So it took me more than a year, but I actually studied for the exam for only 1 week. Believe me, man, just a week. I received my ATT at the end of 2023 July, and I was actually being lazy and postponing to write this exam. So I felt like I was wasting my time for nothing. I was fearful that would I pass or not? What if I fail? What if the SOTA questions are too difficult? What if the NGN is tough? What if I can't reach the exam center on time? What if? Just fear and procrastinations. So, sometimes you need to be brave and make a decision. So I talked to one of my friends who already passed the exam just a month ago. Had chat with him. He encouraged me and explained a bit. Then I booked the exam on 20th of November 2023. I gave myself around 3 months to prepare. I knew all the resources, where to find them, how to access them, online books, YouTube lectures, subscriptions, but it was again me being lazy and kept lingering on and wasting my time. Sometimes on my night shift, I would be doing some practice questions online. I might have done around 3 to 4 full-length papers, 85 questions, and I was around 60% scorer when I checked my result. But it was just the practice questions and easier questions. However, it was good enough to start your journey. If you want to check yourself without paying anything, links are in the description box below. By doing these days and nights, it was a week left before the exam, and I was completely shattered realizing that I haven't done anything at all. The same night I purchased the subscription for Archers. It was 60 days and around $80 I paid. After making a comparison among all others like Klemik, Simple Nursing, Archers, Kaplan, Saunders, and some others on YouTube and different sorts of resources, I found Archers easier, comprehensive, and to the point, so I chose this. Watched all the NCLEX review lectures. It was around almost 30 to 50 videos on all systems, and I watched them one by one. Did nothing else the whole week. Left my phone somewhere. Didn't use any social media the whole week. Come the exam day, complete nervous, and I was actually late at the center, but they let me in. So here are your questions answered, guys. 5 hours total time of the exam. Your questions could be 80 to 150, depends on how good you answer. If you answer correct, the number will be lesser, and if you answer wrong, it will go higher. My computer shut down at the moment I answered the question number 85. Means I had 85 questions. Regarding the NGN, yes, it was NGN NCLEX. It started from April 2023. So in NGN, you have more scenario-wise questions. You will have a scenario, say a case study with all the information about the patient, followed by 5 or 6 different questions. Maybe like you will receive a patient with such and such signs and symptoms. Here are all the vitals and doctor's orders. And the question could be, what could likely be the diagnosis? What nursing intervention you do to relieve such symptoms? What likely be the value of potassium, let's say, or which element you suspect deranged with this? They might ask you rhythm. Then which statement of the patient shows effective education might be the next question. So kind of these questions. How many were there? I would say my exam was full of NGN questions, about 70%. Every other question was followed by 6 or more questions. I had very few standalone questions. So don't expect they will ask you which is the shortest bone in your body, or longest muscle or organ in your body, or how many bones are there. Don't even expect they will ask you such silly questions. You receive such a patient with this rhythm, what medication will you give to your patient, or is it a shockable or non-shockable, CPR needed or not? So there were no anatomy and physiological questions. I didn't have a single dose calculation. I didn't have any single dose calculation questions. I had many SATA questions where each answer was exactly the same, and it was real hard to find which is the best one. So your question will be followed by 4 to 5 different answers. All will be equally weighted for the patient care, but you need to find the one which is preferred, prioritized. What will you do first to relieve the symptoms, and it should be effective as well. That's actually the SATA questions answered. Lastly, potassium is the most favorite thing they ask you in the questions. Cardiac system, rhythms, shock, CPR, lungs, life-saving and pharmacological drugs, and they are at most importance. I would say you should pay attention to. There is a sheet for LPN, RN and non-medical health professional privileges which who can do what. Just have a look in the description box below or download it. Some questions could be from there. Regarding the time, it's really enough time to easily complete the exam in time. It's not like IELTS where you actually feel the time tinnitus in your ears. I finished 85 questions in 2.5 hours, and there's no shame in it. There's no shame in it, guys. Take your full time, think, ponder over, make a calculated guess, but don't haste to make it mistakes. I don't want you to lose any marks. So how do you get score, pass, fail criteria? It's actually a very difficult question to answer, and there is no straightforward simple answer or number to pass fail, but there is a very complex system of scoring based on your performance. NCLEX actually uses a computer adaptive technology to score the exam. That's actually called CAT, based on these parameters. Questions get harder and lesser in number if you answer right, and go opposite if you do opposite. You are scored based on the number of difficult items answered correctly. Not everyone has the same number of questions. It can go from 70 to 130, 135 maybe. The number you score with the correct answers, CAT will use it to find a confidence interval of 95%. It satisfies that enough for you to be a USA nurse and the computer stop asking you more questions. So don't get confused. It's not the percentage you need to pass the exam, but it's the confidence interval of the CAT system, which is 95%. If someone doesn't know what the confidence interval, you can check in the description box below. It's a big calculation involved actually. There's a timeout rule as well. Yes, you have 5 hours, which is quite long time for the NCLEX with breaks in between, but the time doesn't stop. If you fail to answer minimum questions in the time which are set to be 75, you will automatically fail the exam. And lastly, what are the sources out? So here is the list and the links in the description box below. Make a good comparison to go for which is best for you. Don't make a blind guess or just don't follow me. Something which has worked for me may not work for you. And guys, practice, practice, and practice. That's the best advice I can give you and the best suggestion I can suggest you. Don't be lazy like me studying all the syllabus last night. Make a routine to review some of the questions every day, or you can discuss your question in the Deviate group, WhatsApp group chat as well, where many intelligent nurses are on the same path as you. Discuss with each other or make a group for study as well. At the end, if you find this video helpful a bit for you, subscribe for more such content, like and share if any more help you need, and comment if you have any more questions that I didn't answer. Join our other social media groups as well to find your friends to chat with and study along. Finally, just remember, if I can do it, you would definitely do it. Good luck for your US journey, and let's meet in another video.